Frankie service was set up and we used the name of a victim of childhood sexual abuse, a young woman called Frankie, who it came to the attention of the police crime commissioner that if this young lady's story was quite harrowing. She'd been a very bright child, had a promising future, and then experienced sexual abuse as a child, and her mental health took a real kind of downhill ride, and she became very poorly.
Before the abuse happened, I was down as gifted and talented on the register at my school, and they put me forward for academic competitions. After the abuse, I suffered blocked memory, nightmares, flashbacks, anxiety, depression. I felt numb, but also shame and guilt. When I was about 15, I disclosed about what had happened to me. I had to tell my story again and again to different professionals. Some didn't seem to truly listen. I also found it very difficult to get the help I felt I needed. Because of what happened to me had such a big impact on my life, I had to deal with a large number of different professionals. This could at times get extremely confusing. I just wanted help to get better, but I felt I always had to ask and plead for people to listen.
So the service was set up to try to fill that gap, to provide early interventions for children who've experienced sexual abuse from a counselling team, which is what we do. We're counsellors. We're all trained counsellors. We're realising that sexual abuse for children the impact on the wider family is huge, and often other members of the family need support as well as the individual victim.
The way that these issues impacted on my family is my family ended up privately funding some counselling over the years as nothing was available to me. They just wanted to help me get better and be happy. They had to contact many different services over the years to try and find out information or complain when we felt let down. And they also had to cope with the guilt and responsibility that they felt like they should have perhaps realised what was happening and protected me, although I don't think this is the case.
We're placed alongside a children's services team, and we're kind of within the children's services department. So we have access to the children's services records, and we can talk to social workers who are working with the family. So we get quite a lot of background information about what has happened to the child, but also how it's impacted the family.
Things over the way that helped me and worked well for me is it's often down to the personalities of people. Some professionals were kind and understanding and showed real empathy. Some professionals really took time to listen to me and understand the whole history. They took the time to work out with me what might help the most, and as a result my condition improved. We
offer a confidential service, so obviously the work that we do with children remains confidential unless there's a safeguarding issue that's raised. So when I say we work closely with social workers or the police, they're aware of our service. We talk to them about what we do, but we don't talk to them about obviously the conversations we have with children. That's within our confidentiality policy. So when a child discloses sexual abuse, usually to a parent or a member of the family, that family member usually goes to the police. The police would involve social services. So then professionals would be around that family, giving them the right support, immediate support, and taking them through the legal process of getting a case together ready for prosecution if that was going to happen.
I support the Frankie Worker service because I want to improve services for other people, and I want to show them that they have nothing to be ashamed of. I believe that if you deal with trauma early enough, that it might prevent it turning into poor mental health. I believe that if I had had the continuous support I needed early on, I might not have developed these mental health issues, and would like for other people to have the opportunity for that not to happen.
I think that this early intervention it really helps children to understand what has happened to them and be clear in their minds that it wasn't their fault. A lot of child victims develop the idea that it was their fault, it was something that they did wrong. And that can really, just those thoughts can really impact them going forward in life, impact their future relationships, the way they view themselves. Being a teenager is tough on its own without having other baggage to carry through. So I think seeing children as early as possible is a really unique tool, if you like, to try to help them in their future life. It is a very, I feel privileged actually to be in this role, because children are sharing with me and my colleagues some really difficult stuff, and we're helping them to overcome really horrendous things that have happened to them. It is tough, it is a tough job.
I believe in the Frankie Workers service and what it aims to do, and I'm proud to have helped inspire the service for other young people.
I think a theme for me with quite a number of cases I've been working with is allowing children to, or enabling them to see that it wasn't their fault, and what the perpetrator of the act was doing something wrong. I know that sounds very basic, but some of these children are being abused by family members, and so it's really confusing for them because a family member has done something so horrendous. The trauma of it happening is one thing, but then the trauma of telling the family and the fallout that they see going on can be really hard for them to manage, to understand. So just helping them to understand that what has happened to them is not their fault, it's the fault of the perpetrator, and that they haven't done anything wrong. And really that building self-esteem, learning how to like yourself again.